Hit live on YouTube here.
Just tell me when you're ready.
Just gonna wait for it to come through. We are good to go.
Good afternoon, everyone. I'm Dr. Andrew Agwunobi, Andy. I'm the Interim President for University of Connecticut. I want to thank you so much for joining us today. I hope you're as excited as I am that fall will be here soon, and we can welcome you back if you're a returning student, or welcome you for the first time if you're a new student, that we can welcome you to STARS and our regional campuses, Hartford, Waterbury, Avery Point, and Stamford. All our campuses are beautiful. Yesterday, I took a drive around STARS, and with the sun shining on Mirror Lake, the amazing facilities for academics, science, performing arts, and other areas of learning, as well as the residence halls and all the other facilities, and of course, the parks, as well as the luscious greenery and trees around Horsebarn Hill. It was truly perfect. It was perfect except for one missing piece, and that's you, the students. This university exists for you and is waiting in anticipation for you to arrive. University of Connecticut is waiting to give you an education that will transform your life, as well as relationships and experiences that you will never forget. And at the same time, you give us so much, and you make us so much better. So we're waiting for you to arrive, and we couldn't be more excited. By the way, talking about the lack of hustle and bustle of students, a couple of days ago, we actually saw a moose strolling down to Mirror Lake, which gives an idea of how quiet and how idyllic STARS campus is right now. But getting back to today's session, although we can't be in person yet, we wanted to hold this town hall meeting to answer any questions that you might have, including questions relating to the message that our wonderful Dean of Students, Ellie Doherty, sent yesterday afternoon. And that was the message regarding opening of the fall 2021 semester. So we've received a number of questions in advance, and you can submit questions. If you haven't already submitted one or other questions, you can submit some anytime during this forum by emailing communications@uconn.edu. So I know that summer is a busy time for many of you, and so a recording of this town hall will be on YouTube, and you or your family can view it at any time. I have with me a panel of colleagues who are ready to answer all your questions. So let me introduce them. So in addition to Ellie Doherty, our wonderful Dean of Students, as I said, we have our Provost, Carl Lejwe, our Executive VP and Chief Financial Officer, Scott Jordan, our Chief Financial Officer, Lloyd Blanchard. We have our Chief Hans Reinhardt, who leads public safety. We have Nathan First, the head of enrollment management. Terry Dominguez, who leads environmental health and safety. Chris DeLillo, who heads UConn Human Resources. We have Dr. Alyssa Error. We actually have two doctors here. Dr. Alyssa Error of Student Health and Wellness. We also have Dr. David Bannock of UConn Health, and he serves as UConn Health's hospital epidemiologist and head of infection prevention. So he's a real expert on COVID-19 and other infectious disease issues. We also have Michael Gilbert, our VP of Student Affairs. So as you can tell, we have a lot of experts on this panel so that we can answer any questions that you might have. And our moderator for today is Tyson Kendig. So I would like for us to get to your questions quickly. So I'm going to end my comments by saying just a few words about vaccinations. And I know there are a lot of questions about vaccinations, so we'll go into those as well. But to keep all of you safe, we are requiring, as you know, that our students who will be on our campuses in person this fall, we're requiring and asking that they be vaccinated. Now, if for any reason you cannot get a vaccination where you are over the summer, or perhaps you had one vaccination, you had your first one, but you didn't have time to get the second one when we're talking about 2 doses, don't worry, we will offer vaccinations when you arrive. For those of you who desire not to be vaccinated, in other words, you will be seeking an exemption, and that could be either a medical exemption or a non-medical exemption. Please just apply for this exemption through the Student Health and Wellness website, and that website was linked to in Ellie's email yesterday. So I urge you to make an appointment and get vaccinated as soon as possible. And just as importantly, please let us know whether you have been vaccinated by July 1. So let us know by July 1 whether you have been vaccinated. Instructions on how to report this to us or notify us were also included in Ellie Doherty's email that was sent to students yesterday afternoon. It's really important to us that we know who has been vaccinated, who hasn't been vaccinated, so that we can prepare well for the opening. So again, I know that we are going to have a wonderful and safe fall semester at the University of Connecticut, and we're really looking forward to seeing all of you. So go Huskies, and we're going to get straight into our questions. So Tyson, do you want to start reading the questions?
Sure. Thank you, Dr. Andy, and welcome again to all UConn students and others who are joining us on what's a steamy summer day here in Storrs. We did receive several questions submitted in advance, and we'll hopefully be able to address all of them in the time we have allotted. In the interest of time, we may try to merge some questions that are similar in nature. So with that said, if the panel's ready, we'll go ahead and get started. We'll begin with a few questions about masking and campus environment. And this is probably the question I've heard most. Do we still need masks in lecture halls and classrooms, in dorms, and in other buildings? I'll turn to our Dean of Students, Ellie Doherty, and Provost Carl Ledgway.
Hi, everybody. So I know a student texted me this morning and said, I can tell how excited you were in the email. And I really just want to emphasize what President Agwunobi just shared is we want you back. And we are a global university. We want everyone back from all over the world that makes us the special place that we are. And so that's why I sent the link to the color-coded system that we've redesigned and reapplied for the fall. And I will answer the question about masking, don't worry. And I did that because I want you to see, as we did in the spring, that we have a plan for increasing health, and we have a plan for whether or not we get ill as a community. But we're going to start in a place of caution that allows us to set a common sort of level set as a campus and ensure that we are feeling comfortable and safe and healthy as a community. And that means that for the first sort of week to 2 weeks of campus, I want us to make it okay to wear a mask in an indoor setting. And we are almost certainly going to say that for the first 2 weeks of school, we want you to wear masks. We need you to wear masks in indoor settings that have close interactions with others as we level set as a community and have a common good health. And that's important because we may not all be fully vaccinated at that point. We'll be coming from different regions of the country and the world. And it's okay to choose to wear a mask in a setting because it helps you feel better about being around others. So we're going to take that step as a university to start cautious and then walk that back as we demonstrate our good health through vaccination across the community. I also just want to take a moment and remind people of key dates. So by July 15th, if you're requesting an exemption, it needs to happen by then. And we would love to hear from you as soon as possible about vaccination, but we have to know by July 31st, by the end of July. And the sooner you tell us, the better. So sorry, Carl, for the interruption.
No, that's great. Thank you, Ellie. I'm Carl Ledgway, the provost at the university, and I would just say we want to have consistency and clarity, and so the academic setting, specifically the classrooms, will have the same approach that we take throughout other parts of the campus that Ellie talked about. So for those first few weeks, we will be expecting masks in the classroom setting.
Thank you both. What improvements has the university made or does the university plan to make to ventilation and air circulation in classrooms and offices? Director of Public Safety, Hans Reinhardt, I think maybe you can answer that.
I can. Thanks, Tyson. Our experts within our facilities operations group and our Department of Environmental Health and Safety have been reviewing CDC guidance as well as their own technical expertise and have developed a plan in alignment with CDC guidance to increase ventilation in classrooms and teaching labs, as well as increasing outside air flow into these areas. Beginning in the fall, approximately over 150 supplemental air handling units that will be placed in classrooms and teaching labs to meet this goal. So again, increased outside air and increased ventilation in classrooms and teaching labs, supplemented by additional air handling units this fall.
Great. If the vaccination rate reaches a certain percentage, will you remove the mask mandate? If so, what is that percentage goal? Ellie, I'll turn to you.
So I want to be clear in saying our plans are not driven by a magic number or hitting a certain number. And that's because, as we know from the last year, our health can change at any time. And our planning reflects that as well. And so the system where we will use that color-coded system to show you our daily assessment of our health as a community and the prevention measures we need to have in place will remain in place on campus. So there will be a time where we will require things like mask wearing. There will be an even greater time where we won't, and it will be recommended. There could be a time where a variant comes to campus and we get sick, and then we're going to escalate and go back to the things that we did over the last year. So it's not based on a number. It's based on us constantly evaluating the health of our community and inserting the right prevention measures to keep us healthy and safe while allowing us to finally be together as a community and enjoy each other. I will say this, we're at about 67% vaccinated for the residential community. The student disposition is much higher than that, but we definitely need to get that number up. And so I really want to encourage you to get us closer to a much higher number where we're going to feel even more confident in the health of our community as we open and as we apply whatever measures we need to apply to keep us healthy, together, and safe.
Oh, and Ellie, I'll just jump in here, and I presume it's also correct to say that the 67% number is those who have reported to us that we know that are vaccinated. But we believe there's a lot more students out there who are vaccinated who have not reported it yet, and that's another reason it's important to get to notify us.
Yeah, and I believe that because you told me. So when we surveyed the students and asked you what your disposition was on vaccination, it was a much higher rate of participation. So I think this is just a case of uploading those vaccination records to Shaw so we can feel more confident in our planning for opening.
Dr. Andy, you may want to address this. What will UConn do if an unvaccinated person refuses to wear a mask or socially distance?
Well, I am going to turn it to Ellie, but before I do, I would just say that we're going to address those types of situations on a case-by-case basis. The students are extremely important to us. We know that each student has his or her or their own story, their own concerns. We want to listen to that, and so we'll take it on a case-by-case basis. But I'll turn it to Ellie and see if she has anything to add to that.
Yeah, I would add that if you are uncomfortable, we want to be helpful. And we will have clear direction on when masks should and shouldn't be worn, when it is required and when it is recommended. Last year, it was a referral to conduct or to res life if you weren't wearing a mask. And we found that despite all the referrals, we rarely had egregious violations of the procedures we had put in place. When we were making unsafe decisions about the health of our community, it wasn't mask wearing, it was parties. So I want us to trust in each other, know that we consistently made decisions over the course of the last year that allowed us to be healthy and safe as a community. I was constantly on campus seeing students doing the right thing for the well-being of others. We're going to ask that you continue to do that. And we're going to base that in a common trust and care for each other, always knowing you have a resource. So if there is a conflict, if you want to reach out to a staff member with an observation, you are welcome to do so. And those pathways are always in place for you through residential life, our colleagues and community standards, your faculty in the classroom. We want you to feel safe and comfortable. But I also know that we have consistently had students making the right decisions on things like wearing masks when it's appropriate, and we'll be clear on when those times are.
Ellie, I'll keep you on the line to answer this question. Will UConn still conduct COVID testing?
We will. And if you are symptomatic for COVID, we will be available with a COVID test and we will want you to take it. We will also be having surveillance testing available on the STORS campus if you are part of our non-fully vaccinated population. So we will continue to have those medical resources available for students. Lisa,
Great.
Dr. Era, anything you want to add there?
No, we will have testing available as needed, especially anyone who is symptomatic. And then for our students who are not fully vaccinated, we will make sure that we are doing appropriate surveillance.
Okay, we have a number of questions related to vaccines. One writer asked, why is UConn not acknowledging natural immunity that comes with having had COVID-19? Should those students who have natural immunity be grouped with those students who have been vaccinated? We have Dr. Bonnick, our chief immunologist at UConn Health, on the line here, and he may want to address that one.
Sure. Thank you for that question. So it's an important question. And the university is following the CDC recommendations on approaching vaccination for individuals who have had prior infection. And that is to recommend vaccinating those individuals. And there's a few reasons for that. We know that the immune response from natural infection is very variable. So some individuals develop a high level of protection, but not all. And the other question that's come up is the durability and the duration that of protection after a natural infection. So that seems to be less than what's provided with the full vaccinations. So those individuals who are fully vaccinated seem to have both a higher level of antibody as well as a longer duration of protection. And that's really important to consider, especially as we start to look at new variants. This Delta variant is something that has really showed us the importance of high level of antibody protection in order to prevent illness from these variants. So as I mentioned, we'll be following CDC recommendations on this particular topic.
What will the protocols be for unvaccinated students? Will they be required to quarantine before and upon arrival? I think student health and wellness, Elisa, you may want to take that one.
Sure. And I think what's really important to note that we consider students who arrive on campus who are not fully vaccinated will be put in under the same umbrella as our unvaccinated students. So what we consider fully vaccinated is that you are fully 2 weeks out from the last dose of an FDA authorized or WHO listed vaccine. So those are the two criteria you need to be considered fully vaccinated when you arrive on campus. If you are not fully vaccinated based on that definition, then certainly when you arrive, we would request that you go into a 7-day quarantine, and those details are on our website. And if you are in a residential situation, we will sort of help you manage that quarantine period. And then again, we will be offering, as Dr. Agwunobi had mentioned at the beginning, if you are unable to be fully vaccinated or you arrive to us unvaccinated, we can catch you up. But the best thing you can do is to arrive on campus. If you intend on being vaccinated, arrive fully vaccinated.
Elisa, could you talk more about an international student who may not have had access to, who may have just really accessed what was available in their country, but it may not be authorized by the WHO? How will they be welcomed on campus and provided access to vaccine?
Well, certainly welcomed with open arms and in a way that we will be able to reach out to you individually. And if you were not able to obtain a WHO listed vaccine, we will, make sure that you have access to vaccination when you arrive. And again, for students who arrive to us who were unable to arrive fully vaccinated, we are here to support you. But if in your situation you have access to vaccine, we highly recommend that you arrive to us fully vaccinated. It'll make your lives much more integrated, and in terms of the quarantine and the testing protocols that will be in place for those students, you could avoid that completely.
So just to nail it down a little bit for those students who are wondering what this will really look like, we are in close contact with ISSS. I know they're reaching out to you, and I really want our international community to understand that we know you're facing some challenges and we're going to work it out together. That may require additional vaccination, as the CDC gives us the thumbs up on that. If you're not fully vaccinated, there's going to be a modified quarantine that will last probably around 7 days. It could be more if you are coming from a travel restricted area. That modified quarantine, though, will mean that you're able to go to classes. You have a little bit more opportunity to engage with the community than you experienced last year. And we will be writing you directly, letting you know exactly what that is. So I think you see why Dr. Eyre is really encouraging that you be complete on your vaccination. But no, as Dr. Agwunobi was sharing, we will take care of you if you can't be complete with that full vaccination. There'll be a period of adjustment while you're here on campus, but we're going to make it as comfortable as we can. I know you don't like quarantine, and I know you want to be with your friends, and all of that has gone into the planning.
And to Ellie's point, for our students who are coming from international destinations where they didn't have access, we will fully support you and make sure that you meet the threshold of becoming fully vaccinated after you arrive, if that is your intent. So if I'm going to circle back, I see one question in the chat that if you are coming internationally and we're unable to get a WHO listed vaccine, you do not need to apply for an exemption. Share with us what you have. We'll meet you where you are and get you on the path to being fully vaccinated if that is your ultimate intent. And use the exemption if you really have a strong conviction, medical or non-medical reason for not being vaccinated. But if your intention is to be fully vaccinated, we will help you get there.
So Ellie and Elisa, you obviously saw questions that came in live from our international students, so thank you for addressing those. We did have a follow-up from an earlier question. Will there be different masking and safety policies, or will all policies outside of testing and quarantine, if there's a positive test result, be applied to all students? Ellie, do you want to take that one?
So publicly, the university for students will have a common understanding of when we are engaging in prevention methods, and that will be our color-coded system. Privately, for students who are not fully vaccinated, they will be specifically advised by SHAW on what additional measures they need to take. How'd I do? I know that was a long question, and I appreciate the thoughtfulness of it.
That's great. Thank you. What non-medical exemptions for the COVID-19 vaccine are SHAW accepting? For example, are only religious reasons being allowed, or are other more subjective reasons allowed, like legitimate concern about evidence side effects, not having sufficient knowledge to make an educated medical decision, etc.? Ellie, I think this one's probably in your wheelhouse as well.
Yes. So the non-medical exemption is not being reviewed by the medical team, but it is being reviewed by the university. So I want to make that distinction. And in keeping with the intention of that exemption, which is this is a new vaccine and we have some apprehension and concern about it, any reason is considered for an exemption. In fact, the form is blank. So we want to know exactly what your concerns are. We're going to evaluate them within the health of the greater community and make a decision individually based on the reasons that you present to us. So there is nothing we won't consider as grounds for an exemption. We welcome any and all reasons for why you feel you would like to get that exemption, and we will review them individually and follow up with the students on those decisions in early August.
This one is for a physician, so I'll look to Dr. Bannock again. If I am fully vaccinated and my roommate is not, and we are maskless in close quarters, do I face any risk, or does he? Does the vaccine prevent you from getting COVID, or does it just prevent you from getting sick from COVID?
You're on mute, David.
So thank you for that question. I mean, what we know is that these vaccines are effective in many ways. They do prevent individuals from becoming infected, and they are extremely effective in preventing individuals from becoming symptomatic and particularly severe illness from COVID-19. And I think what we've learned most recently over the last 6 months with widespread offering of these vaccines throughout the world is that these vaccines reduce the spread of the virus. So an individual who is vaccinated is much less likely and probably at very low risk of spreading it to others. My main concern at this point is individuals who are not fully vaccinated. Those individuals, unfortunately, do remain at risk for infection, both infection with minimal symptoms as well as severe infection. And as we start to see emerging variants that seem to be spread more easily, that is the group that I would say is at higher risk, the individuals who are not fully vaccinated.
Related to the previous question, can a fully vaccinated person get and spread COVID without knowing it?
So I think while it could be plausible that would happen, I think the risk of that is low. We know the vaccines are effective in preventing infection and also effective in reducing the potential of spreading an infection, spreading the virus to others after becoming infected among those who are fully vaccinated.
What can students do to urge their classmates to get vaccinated? Ellie, do you want to take a stab at this?
Yeah, and I'm just going to use this as an opportunity to say our students are amazing educators, and I thank our leaders in undergraduate student government. So Mason, Ethan, Michael, I'm thinking of you. I thank our PAC ambassadors. I know Nora and I have recently had conversations about the work she is doing. Students can talk plainly with one another, and you should continue to talk about what you're worried about, the science and why we have confidence in these vaccinations and how it allows us to bring you back to the experience that you want. And students are really willing to talk about this with you as peers. And I know our ambassadors and student government has a lot of information available where they want to hear you, they want to understand the concern, and they want to provide information. So I said, some people are asking questions about roommates. We'll be opening as a residential community with our vaccination requirement, just like the rest of campus. But this prompts a conversation on just how do we maintain good health with each other? How do we make sure we're informing each other if we're not feeling well, whether it's the flu or a cold or you're stressed and you need to talk about it because of finals. Talking sincerely with the people you care about most about what you're worried about and also why you care about them and the decisions that they are choosing to make for their health is always a good idea. And it is my goal to make sure you have all the information you need to make that right decision. So I encourage students to let us know if they have specific medical questions about their care. We're available to talk to you at Shaw. Your campuses at the regionals are available to talk to you as well. And I really can't say enough about our leaders who have come to me from the student body and sought opportunities to speak to each other. Starting this Wednesday when we have a forum in Hartford with student leaders, myself, Dr. Bannock, community leaders, to really provide a space for us to talk plainly about the importance of overcoming COVID and the individual actions we need to take to ensure that.
Ellie, just piggybacking on one point that you talked about with roommates, can students request a vaccinated roommate?
No, they cannot. So the medical record is private and confidential. We routinely have students in the residential halls who are exempted from vaccination requirements, but that is the exception and not the rule. Our expectation is that the residential community will be fully vaccinated.
Dr. Bannock, this question that just came in may be best suited for you. What if I got one dose of one vaccine and I get to campus and my second dose is of a different vaccine? Is that okay?
So that's a good question. At this point, the recommendation is to receive the second dose of the same vaccine that you received your initial dose. Unfortunately, here in Connecticut, the vaccine availability is quite high. So, I think we at UConn Health would be happy to work with the campus to provide any assistance with obtaining vaccines to help individuals get the second dose of the same vaccine that they received with their first dose. I don't know if Dr. Eller, do you have anything else to add on that front?
I would just say for our students that are stores based, we would certainly be prepared to provide whatever second vaccine that you require. And if it's, again, if you're coming internationally and you have 1 dose of AstraZeneca and we don't have a second AstraZeneca in the United States for you, I think the recommendation, and Dr. Bennett can confirm, is that we would just start over and get you revaccinated from the beginning. And that seems to be the safest route, and we'll be prepared to, again, meet you where you are. So.
A student has forwarded this question: will employees be required to get vaccinated? Crystal Ello, our human resources executive, can take this one.
Certainly. At the present time, faculty and staff are not required to be vaccinated, but we've strongly encouraged that throughout the spring semester into summer with our on-site vaccination center on campus through the partnership with UConn Health. We continue to evaluate the health of the community along with all the other leaders on the panel, and we'll make an assessment not only prior to reentry but during reentry to protect the safety and health of the community.
We have a handful of questions about classes, campus events, and the like. The first one would be, will there be any distancing rules on campus, and will the size of student events be restricted? I'll open that up to anybody who wants to chime in.
I can share in terms of classrooms. Right now, we are planning for, particularly with students being vaccinated, to not have distancing in our classrooms. If for some reason that needs to be in place, we will be able to adjust. But right now, we're assuming that there wouldn't be distancing.
Yeah, more or less. We'll be prepared in dining halls, res halls, student activities for what I will call full occupancy. And again, more or less. Sometimes we may ask you to space it out a little bit. But I think what's important there is we're really thinking about the actual occupancy number. So that the fire marshal gives us, that's posted on the wall. Sometimes we have rush periods and we kind of cram a space. And I think you can expect us to be monitoring those numbers more closely to ensure we're keeping that occupancy level where it needs to be and we're not overly compressing a space with folks.
Will vaccination exempt students be allowed to partake in all the events, classes, and activities as vaccinated students are from the start of the semester, assuming they do not test positive? Ellie, do you want to start with an answer on that one?
Yeah, and the answer is absolutely. And I also appreciate how well thought out that question is. So obviously, if you are ill or symptomatic, no. If you're not a vaccinated student and you're symptomatic for COVID, we'll be talking with your medical provider about isolation until those symptoms resolve. But overall, a student who is not fully vaccinated or is exempt from the vaccination requirement is welcome in our community, and you are welcome to be a part of activities and programs. Just know that there will be additional specific private information that will come to you from SHAW telling you about additional measures we need you to take to keep you healthy. Those will not be advertised across the campus. Those will be told to you very specifically, but you are as valuable a member as anybody else, and we want you to be part of that experience. We just want to make sure we're maintaining your good health.
Provost Lejuez, this one is for you. Will students have the option to participate in online classes this fall?
Yeah, so we're at our best when we're an in-person educational experience, and we've worked really hard to be able to ensure we're as close to as a typical semester in terms of in-person opportunities for classes. At the same time, we do have a somewhat larger number of online options, and this can be really helpful for students who are looking for 1 or 2 classes where they would like to have a mix of in-person and online. There can be some cases, we certainly can't guarantee that any student would be able to have all of their classes be online, but if a student either wants to have more online than they have or to try to have a full online offering. We encourage students to reach out to their advisors as soon as possible, and we'll do everything we can to try to accommodate.
Great. If there are lots of positive cases on campus, will residence halls get quarantined even if most people are vaccinated? Ellie, do you want to take that one as well?
It's possible, but I would say unlikely. It was very helpful in containing spread in a time when there wasn't a vaccine, and it allowed us to do that effectively over the course of the last year. Now we have a vaccine, so I think it stands to reason that it's going to be that we are mitigating spread significantly by having a population that is vaccinated and safe on campus, and so the need to do that additional measures is not really there. I do want to be transparent. If we had a variant come that was, spreading across campus, we'll do everything we can to control that spread. And that could include doing a residential quarantine. I do think it's unlikely. I don't know, Dr. Bannock, do you agree with that characterization when we're looking at a vaccinated community?
Yeah, no, I agree. Based on all that we know at this time, the vaccination is highly protective in preventing that type of situation. I think if COVID's taught us anything, it's that we have to be prepared and thinking about all the possibilities. And certainly what you described in terms of planning makes all the sense. But at this point, from what we're seeing, the vaccines are highly effective in preventing a rapid spread of COVID.
Will move-in be normal for the fall semester except for masks? Like in previous years, our parents or friends can come into the dorm?
I'm excited to answer that one. Yes. So it's going to be the 27th through the 29th. I know families missed the opportunity to really help their student move in. We may, we'll check our health in August. We may say a couple family members, not many family members. You may see some movement there. But I mean, yes, let's go back to the move-in we love. It's going to be over those 3 days. You will have a time period that you'll sign up for. We need you to follow that so we can have a steady flow and be conscious of volume in our buildings. But yes, your families can help you. The RAs will be around to welcome you. For the first years who didn't get this last year, I'm so excited you're going to get it this year. And I think you can see a lot more normal than unusual this August.
Ellie, again, I'll ask you to stay on the line for this one. Will out-of-state travel for club sports like club track and field be up and running for the fall and the spring? And to clarify, we're not talking about Huskies varsity Division I sports. We're talking about club sports.
Yeah. So I had the great pleasure of talking to my colleagues in student activities and rec today. We absolutely want you to resume travel. We just need to revise the university's travel policy. So that work is still ongoing, but know that that is absolutely our goal for the fall. I think the students have been very clear that they miss rec sports and club sports, and we're bringing them back.
Great. We did have one question come in on federal aid for students. What is the status of the financial aid money from the federal government that was intended for students? And how can I apply for this? I know we have Nathan First, our Vice President for Enrollment Management, who may be able to provide some insight, and perhaps our CFO, Lloyd Blanchard, may have some thoughts as well.
Absolutely, Tyson. So first of all, anytime a student needs financial assistance, they should go to the financial aid office. We are gearing up for another round of funds, federal funds that will be available to all students, regardless of whether you filled out the aid application or not. That's an important point. And we'll be sending out information via email, but we had a really great conversation yesterday with Mason and Ethan and Michael, giving them a shout out as I did before, your student leaders, about how we want to make sure that we get that information into your hands such that you can apply for the assistance. That will be a very simple process. We're lucky that the federal government, I think, has provided a lot of support for our students. And so we'll begin to mobilize that in the coming weeks and let you know what that process looks like. Let me just add one other thought, and that is, if you haven't applied for aid and now you need aid, or if your situation has changed from your FAFSA, there is an appeal process available always. And you should go through that process if you think that your financial situation for your family has changed to the degree that it might impact your financial aid package. So go to the financial aid office. That's the easy answer, and they'll put you in touch with the right resources. Lloyd, I don't know if you want to add anything to that.
I have nothing more to add. Thanks.
Okay, and we have one final question in the queue right now, and this has to do with vaccines. What vaccine will Student Health and Wellness be offering? And if a student wants a different vaccine, will you be able to provide it? Dr. Ehrer, do you want to handle that one?
Sure. So we have a close collaboration with Connecticut Department of Public Health, and we should have access to any FDA authorized vaccine. So if we will be able to provide any vaccine. We anticipate being able to provide any vaccine that is authorized. So both mRNA vaccines, whether it's Pfizer, Moderna, and then the J&J vaccine also. So that's what we'll have. Again, if you come partially vaccinated with the WHO vaccine and we're not able to, offer the vaccine that you started with because it's not authorized in the United States, then the recommendation is to start over and we'll get you caught up and get you covered. So any individual questions, please feel free to reach out to us directly and we'll be able to walk through your individual circumstance.
And Elisa, looking at the chat, if a student arrives early in August, well before move-in, I think this is very relevant to our international students. Can they sign up for an appointment through Shaw, through the portal, to get vaccinated?
Absolutely. If they are stores-based students, we'll be here for you. We're here for you now. You can sign up for an appointment anytime. But when you arrive, just let us know and we'll get you taken care of.
We did have another question just come in a moment ago. Will students be able to travel to national conferences? I'm not sure who would be best positioned to answer that, so I'll open that to the floor.
I can take this. I think we need to be careful about ensuring safety, but we are planning to have research and other experiences as we have before, and certainly domestically, as long as it can be done in a safe way, we plan to have this available.
Okay. And Ellie, you had talked about the different facilities on campus available to students, the rec center, the library, student union. Is the assumption that generally speaking, those facilities will all be open and operating normally?
Yes, absolutely. With, again, students who are undergoing quarantine, having some more specific directions from us, but we'll be open and ready.
Okay, well, we have gone through all of the questions that we've received, both in advance and live. Dr. Agwunobi, I will turn it back to you for any closing thoughts you'd like to share. Thank you all.
Well, thank you so much, Tyson. Thank you for hosting this. And I'd like to thank all of the students who are listening in, and thank you for your great questions. And please submit, you may have questions that come to you afterwards. Please submit them to Student Health or Student Affairs. And I'm sure that in Dean Ellie Doherty's letter, she must have had a link there that you can send questions to, correct, Ellie?
Yeah, I think students know how to reach us. There's by office, you can write back to my email with any questions. That's probably the easiest thing, and we'll get them in the right hands.
Okay, wonderful. So if you have other questions, you can send them in to Ellie Doherty. I just want to thank you all for being here today, and we're really, really looking forward to seeing you in the fall. So go Huskies and have a great rest of your week. And thank you to the panelists, of course.